Okay, every once in a while I'm going to post interesting lab reviews on patients. This is a patient that's with us who's on testosterone therapy. I've deleted all the names so I can post this information, but we can also have this video for the patient to observe. We did a cholesterol panel, looked beautiful, so I didn't include the normal green. Cholesterol, chemistry, liver, all those look normal. I'm going to review the aspects that stand out and review this. I found this one interesting to talk about. This patient's on testosterone therapy. I have a nice presentation that goes over testosterone results. First of all, if you're on injection, you're going to see a peak and valley effect. This is a good number. It depends on what day the patient injected. It's going to be higher, closer to their injection point. It's going to be lower the further out. I find this series of labs interesting because the TSH is 4.49. Look, it's almost abnormal. The scale is 0.4 to 4.5. Functional ranges where we're trying to pay attention to the patient's health. That patient obviously has some degree of thyroid dysfunction. Even though the free is high, the TSH is high. So if the patient were still having fatigue or low energy, sluggish, anything that fits hypothyroidism, I would consider starting the patient on Armour Natural Thyroid. Despite a high free and the TSH being high. Now, many practitioners would suggest we make sure the patient doesn't have antibodies. That would be thyroid peroxidase, anti-thyroglobulin antibodies. If the patient feels okay, I may not push them on this. So that's the first thing I need to comment on. But the testosterone number looks good. There's a free testosterone that's high, but free is always high when the patients are self-injecting. So it almost becomes a useless parameter. Now, we have estradiol being a little bit high. It ends up being about 5% of the total value, so that's the case here. I would only add an estrogen blocker if the patient's having any type of symptoms of breast swelling or nipple tenderness. Otherwise, I would also just watchful wait on this. And typically a patient like this, I'd repeat labs in 6 months unless we do a new intervention. A new intervention means if we decide to start them on some other medications like thyroid. The hematocrit's floating up. The patients need to learn that they need to donate blood religiously every 3 months. That's probably what the blood bank limits them to, or they can do medical phlebotomy. I do like optimally to see this value below 45. And the last thing is the white count was high. We don't get worked up unless somehow they're having an infection right now. Maybe they recently had an infection. We can repeat that, but nothing too much to get worked up about. And then the vitamin D is 59. That's good. They either supplement or they're outdoors a lot. So that's the lab review, and I thought this one was worth posting.